Hello, my name is Dr. James R. Golding, and you're watching A Natural Health Care Alternative, the show dedicated to your health, longevity, and well-being. For you women viewers tonight, I implore you to not change the channel, because our program tonight is the treatment of menopausal and perimenopausal related symptomatology. This condition or state is something that the vast majority of women are going to go through during the course of their life. The start of perimenopause can be as early as 30 to as late as a woman into their 50s. Perimenopause is the onset of menopausal related symptoms, but is not truly menopause, and the reason for that, the difference, because most women think of it as like premenopausal symptoms. The difference is this. Before a woman's estrogen starts to decline or drop, there's actually a diminution or a decrease in progesterone, the secondary female hormone. There's a decrease in progesterone and an increase in estrogen. This increase in estrogen is where we get the onset of perimenopausal symptoms. Those can include irritability, premenstrual syndrome to a greater degree if women had it before, irritability, memory problems, heavy bleeding, irregular menstrual cycles. So that's characteristically what that period of time is, that perimenopausal phase, is that it's an exacerbation of usually the stuff that they'd experienced before. In the onset of menopause, what we're seeing is a decrease in estrogen. But what I find with talking to women is that they're thinking that their estrogen is decreasing, so they're getting all of these symptoms, which is usually not the case. What's happening is that the estrogen cycle is starting and stopping abruptly, meaning rather than having a gradual decrease in estrogen over anywhere from months to many, many years, what we're getting is that the machinery that manufactures estrogen is going through a phase in which it is imbalanced. It starts and it stops, and it starts and it stops, and then gradually decreases from there. The symptoms that we can associate with that are hot flashes, insomnia, night sweats, irritability, memory and fatigue-oriented problems, and associated decrease in sexual desire, decrease in vaginal lubrication. We can have bladder-related problems and actual shrinkage of the bladder and shrinkage of vaginal tissue. So those would be normal symptoms associated with the menopausal state before a woman eventually gets to the point in which estrogen is, at a very, very low state, but continuous across the board, and then they feel fine again. It was once thought that a woman, once they reached menopause, stopped producing estrogen, which is really not the case. A woman produces estrogen, but at a much lower level throughout the course of their life. Years ago, and still now, what they thought was that, well, since all of these menopausal symptoms are caused by a lack of estrogen, what we're looking at is an estrogen deficiency, or just this depletion of estrogen. So what they did was they started hormone replacement therapy to help to counteract these symptoms. What they found was that they have a whole host of symptoms that come into play that have deleterious effects, negative effects on a woman's system, increased cancer risks, cardiovascular problems, vascular difficulties, fibroids and growth problems and things like that are associated with hormone replacement therapy. They have a greater understanding of it now. They're using less amounts of estrogens than they used to, but I'm really not a big proponent of hormone replacement therapy unless it's absolutely necessary. What I am a proponent of is that a woman makes dietary changes to increase the foods that have estrogenic quality. And those foods would be number one, yams. So if you have these symptoms, I want you eating a lot of yams. I want you eating a lot of beans and legumes of all sorts. Red beans have a lot of naturally occurring estrogens or estradiols in them. As far as supplements go, if you're looking for supplementation to take, evening primrose has a high amount of precursors for hormonal regulation, and I want you to consider taking evening primrose oil. It's available in health food stores. I want you to consider taking borage oil. I want you to all take some vitamin E, usually about 400 milligrams, and I recommend that vitamin E be in a dry form. And you can also take, either in a supplement form, phytoestrogens. These are plant-based estrogen compounds that you can get either in supplements, eating high amounts of leafy green vegetables. These will help to increase the external portion of your intake of naturally occurring estrogens. After that point, if that doesn't get it, using some of the natural salves are also good. But they're not going to. They don't give you the same amount of known quantifiable amount. We've talked before about getting hair analysis done, calcium magnesium balance, and things of that sort, which we've gone in before, and we'll provide you information if you're more interested in it later on the show. But what we're going to focus on today is using acupuncture, traditional Chinese acupuncture, as a treatment for menopausal and perimenopausal symptoms. And another thing to keep in mind is that you may introduce into your lifestyle, you could take some herbs. You can take Chinese herbal medicine. Dong Quai is one thing. Dan Shen is another Chinese herb that are very, very effective with the treatment of that. For mental symptoms, you can take ginkgo biloba, which is very good for mental clarity. It can help with the memory and fatigue problems. We can also increases your oxygen to the brain. For depression associated with menopausal symptoms, there's a lot that indicates taking milk thistle and St. John's wort additionally in the diet can help. Taking small amounts of cayenne pepper can also help to squelch the symptoms. So there's a lot that you can do naturally to counteract that. But our focus in just a moment is going to be acupuncture and the treatment of menopausal symptoms. Hold on.
These kids are in trouble. They're not getting high on drugs or stealing. If they were, you'd do something about it right now. But why is it almost half of all parents who suspect their child has a problem learning wait a year or more before getting help? Why? Kids with learning disabilities are smart. They just learn differently. Call now. The sooner you get help, the better the chance your kid has.
Welcome back, and with us today is Mary Ethel Schmidt, a well-known actress, producer, and director from Manhattan who has come to work with me today. Mary Ethel, thank you for coming on the board.
Thank you.
And she's going to be my model when we demonstrate the treatment for menopausal and perimenopausal symptoms. Mary, let's have you come and just stretch out on your back for a moment with your head up here. I'm going to put this pillow right underneath your knees. Now, most women experience some degree of symptoms associated with menopause. Not everyone's necessarily going to come in to see me, but women that are, consumed with these symptoms because they've gone from mild irritations or mild dysfunctional symptoms to really influencing their ability to work right is when they're going to come and see me. And those more common things are when we're looking at heavy menstrual bleeding that just doesn't seem to end even after medical treatment and D&Cs. We're looking at memory concentration problems to the point in which they, just can't remember nothing. The hot flashes are so great that they can't get rest. They have insomnia that's severe, very, very pronounced. Irritability. their emotions are off, and then they have depression. That seems to be, you know, a side-associated symptom, and is not even affected by medication if they're on medication for depression. So those are the criteria upon which a woman would come in to see me. Now, before I start, when a woman comes in, we give them a health profile. We're going to discern whether or not they should be in to see me and whether this is the right place for them. I'm going to discern whether Chinese herbal medicine or whether Western clinical nutrition or lifestyle components to their condition can be added so that they can do these things at home, and that's different from each woman, depending on whether they're taking regular medications or what their composition is. So we're going to take care of that so that we can minimize the nature of the treatment. A good thing to ask is that, well, you know, how does this whole thing with acupuncture work for the treatment of these symptoms? Number one is we're going to treat each symptom simultaneously with what the woman's presentation is, and we're going to treat the underlying root cause, or that hormonal imbalance. We're going to help to bring that into homeostasis for where the woman is at that given point in time. The mechanisms chemically by which a woman is influenced by acupuncture is one of 5 things. Number one, we're increasing endorphins. Endorphins are a natural hormone that helps in healing and create additional hormonal balance in the body. Secondarily is that with the use of auricular medicine or ear acupuncture, as I'm going to see, we will actually influence the actual cycles of estrogen and progesterone simultaneously. Third is that acupuncture creates a general tranquilized sensation over the body. It's very, very tranquil, and it eliminates blockages or abnormal areas of tension in the body. The additional thing is that it's going to increase the normalization of flow of energy within the meridians or actual channels. It's a bioelectrical circuit in the body that if imbalances are present, these things we're going to eliminate those imbalances, and there's going to be more of a circulation of blood flow, electrical flow within the body, tensions, and just emotional state and chemical state of well-being. How long is an acupuncture treatment? An acupuncture treatment borders on about 45 minutes for this condition. In general, a woman would be treated for roughly once a week for anywhere from 4 to 5 weeks, and then they'll gradually decrease. The duration of the treatment, or whether a woman would need more treatment beyond that point, it depends from person to person. But if they did, it would diminish. The effect from a singular acupuncture treatment can be measured in a woman's system for 6 months after a singular treatment. So I mean, it's not one of these things where like you're getting a treatment and then it's going to go away. The effect is going to go away real quick. It actually lasts a very, very long time. Mayor, do you have any questions before we start our protocol today?
I have no questions.
No questions whatsoever.
No,
this is good. So a woman comes in. We're taking the patient's health history. The next thing we're going to do is that we're going to take a woman's pulse according to Chinese medicine. What this pulse does is that we're measuring one of what is 27 different qualities within the pulse. And that taking of the pulse is going to give me an indication of whether a person is what they call excess or deficient, meaning that their body is either depleted in kind of their little body's getting to be a little bit more worn out, or whether they're or what they call wiry or tense or excess, too much energy in the body. Now with Mary, she has what's known as a slightly deficient pulse, and it's in what they call the kidney region. So we're going to be treating this particular meridian, the kidney meridian, when we start our acupuncture. The next thing I'm going to do when a woman comes in is I'm going to take a look at their tongue. Mayor, let's see the tongue. Okay. Now, when we're looking at Mary's tongue, what we see is a slightly scalped margin around the ridge of the tongue, and that will usually accompany the fact that there's underlying fatigue and cold symptoms in the body. This tongue is indicative of weakness within the kidney channel, which frequently happens as we get older and we're undergoing a lot a lot of hormonal changes in the body. Very good. Thank you. Yeah. Okay. The next thing we're going to do is we're going to do palpation that goes along the lines of the symptoms associated with menopausal related symptoms. And these are acupuncture points that frequently need to be needled are tender. And those regions, is that tender there to the touch?
The first time was tender.
Okay, right at that point. So what I'm going through is a diagnostic pattern that gives me an indication of where I should be. Is that sore?
Yes.
Is that sore as heck?
Yes, it is.
Okie dokie. How about here?
No.
Okay. How about right here?
No.
Okay. Not like it is here.
No. Right. That's.
Okay. And how about here? A little sore?
No.
How about along this margin?
Yeah. Yeah.
Okay. So we're going to be taking care. We're going to be treating what's known as deficient kidney yin. That's the official Chinese diagnosis for this underlying perimenopausal, menopausal-related symptom pattern. And we're also going to be treating symptoms that deal with irritability, fatigue, night sweats, and insomnia-related symptoms. Now, all the needles that we use are single-use disposable sterile needles. And I want you to know that this is not going to hurt me one bit. And it's not going to hurt her either. Acupuncture does not hurt. Some of the acupuncture points that we needle are slightly tender to the needling process. Acupuncture needles don't have anything in them. It's the point that we're needling that has the actual physiological effect within the body. It's not that it's a situation where there's anything injected into the system. Acupuncture is, however, invasive, meaning we're taking something from outside the body and creating and putting something inside the body. All needles are single-use disposable sterile needles. And we're going to start down by the legs today, and then we're going to work up into the head region. Now, the first point that we're going to needle this is known as spleen 6. And this is a point that is the meeting point of all of what they refer to as the yin meridians of the body. These are the meridians that deal with your underlying fabric, your underlying actual anatomical state of well-being. The next point that we're going to needle is known as liver 5. Liver 5 is an actual accumulation point that is frequently and intimately related to women's menstrual cycles. The other points that we're going to needle down here, these are along the kidney channel, and this is direct treatment of what we're referring to as the underlying deficient kidney yin. And these points, what these points are going to do is these are very, very good for night sweats. They're very, very good for hot flashes. They're very, very good for insomnia. Now, this is a point that we're going to do next known as liver 3. Liver 3 helps to increase the normalized flow of qi, or what's referred to as the energy circuit in the body. Frequently, a woman, if she has head-related symptoms dealing with frustration, anger, irritability, breast tenderness or distension, they can actually feel those symptoms go away. During the course of the treatment, we'll actually pull that corrupt or abnormal feeling right out of their head. This is usually, we'll accompany this with different forms of what they call deficiency headaches. This point that I'm needling right here, this is known as gallbladder 42. This is a point that also deals with symptoms on either side of the body. So this works very, very well as far as menstrual patterning goes. Now we're going to be working up into the body, and what we're going to do next is that we're going to needle what's referred to as large intestine 4. And large intestine 4 is one of the strongest acupuncture points in the body. All acupuncture points are not considered equal. And what happens is that when we needle, certain points have more value or more power than others. And this is one of the strongest points of the body. This is going to deal with anything that deals with digestive-related symptoms that may relate to menopausal stuff, or it's going to relate to anything that is going on in the head: depression, insomnia, irritability, concentration, memory, and fatigue-related problems. The other thing, now we're going to work up into the head here, is that we're going to be needling a point called yin tong. I do this on practically every woman that comes in with menopausal-related symptoms. This is a generalized tranquilizer. This is the woman will feel very calm and sedate in just a few minutes. And, the treatment itself is very, very enjoyable. We have calming music. I'll also give patients educational material on meditation and how to lifestyle-oriented stuff. Calm and sedate. Now we're going to be moving on into the ears. This is a whole separate system of acupuncture. It's known as auricular medicine. It is not traditional Chinese acupuncture, but it's acupuncture related to Western-style anatomy. Now what's going on here is that there's a nerve, and that nerve is called the vagus nerve. It's your 10th cranial nerve. That has what they call somatic or exterior portions of the ear are represented in that portion of that cranial nerve. So when we stimulate that nerve externally, what happens is that it reflexes directly to the brain stem, and they've correlated these areas on how to stimulate that. So what we're doing is we're going right to the endocrine areas of the brain and stimulating that to create either a normalized balance or an increase of those hormonal values. But usually it's a matter of normalizing endocrine imbalance is what we're shooting for. Now the amount of needles that we're going to actually put into the ears can be anywhere from 5 to 10 needles. How does that feel, Mare?
It feels fine.
Okay, it's not painful?
Initially there was tenderness when you put it in, but it's fine.
Okay. Most of the time it'd be slightly tender when I just needle it, and it'll kind of dull out, and then there's a generalized, real tranquil sensation that comes over the course of the body. So what we're doing is that we're overlaying two separate systems of acupuncture. We are doing auricular medicine, which deals with this Western-style anatomically based acupuncture. We're doing traditional Chinese medicine, which deals with the meridian-based theory and understanding of the way that the energy works in the body to influence chemically. Many times women have a difficult time initially when the thought was someone who recommends acupuncture, like how's that going to help the symptoms? But what happens is that it's almost like very similar to like a bee sting. It creates a tremendous chemical upheaval in the body, and that has a tremendous healing effect, especially when it comes to the hormones. When I started out in practice 25 years ago, I did not realize the amount of women that would come to me for menstrual-related problems, anything gynecologically related, infertility, which we know from other episodes that we spend a lot of time dealing with. I didn't think that that was going to be a real big component of what I do. But what I came to find is that the woman's endocrine system is such a delicate balance. It's such a sensitive thing. And acupuncture is such a strong tool that using that really creates, it's a wonderful thing because there's low to no side effects associated with the treatment, and as opposed to other treatments for hormonally based inadequacies or imbalances, and it has long-lasting effects. So I mean, it's just really a key thing. Now, depending on the woman's symptoms, if they have a lot of cold, usually they're heat-related symptoms. They're only cold-related symptoms when a woman has underlying deficiencies in the body. So we'll use a combination of acupuncture coupled with either laser acupuncture or moxibustion, which is the waving or burning of a Chinese herb above the areas in question that help to nourish the underlying deficiencies that are going on in the body. So I don't usually do a lot of that in the office, but the actual moxibustion, I have a woman do that at home under my instructions so that they don't need to come in from that separately. A good question would be, like, when would you expect to experience a change in the nature of the symptoms? Sometimes it can happen right on the table. The actual change is occurring in your body as we start the treatment. But what happens is that in severe cases of severe night sweats, it can take up to a month to 6 weeks to get some of the more resistant symptoms to change with the condition. Some of the things like irritability, insomnia, these things treat very, very easily, very, very quickly. So there's a tremendous positive feedback loop that happens quickly with using acupuncture and traditional Chinese medicine. Sometimes we'll go and use the acupuncture with Chinese herbal medicine. Sometimes women come to see me because they don't want to take things anymore. They don't want to take medicines. They don't want to take herbs, or they don't want to take stuff. So that's one adjunct is do the acupuncture because it helps them so great with that. The other thing that it works marvels with is the normalization of irregular menstrual patterning, or dysmenorrhea, or meaning painful menstruation, heavy menstruation, or these things where it looks like the menstrual symptom's going to stop, but it doesn't stop, but goes on and on like that. So these are all things that can be regulated using acupuncture and traditional Chinese medicine. When a woman comes in, characteristically, we go right after we do the initial workup. The treatment is going to last, as I said, 40 to 45 minutes. We usually do a reassessment of their condition, meaning the tests that we originally did on them when they come in usually about 4 to 6 treatments. If acupuncture, wonderful thing about acupuncture is that if it's going to make the difference, and it frequently does, because I can tell. Usually I've had enough experience with it, I can tell right from the get-go whether I'm going to help them. But the wonderful thing about it is that a woman does not have to come long before they know and I know that they're getting better from the treatment. Meaning there's not many things that within acupuncture do not treat. Within anywhere from 4 to 6 treatments, a woman should be tracking well underway for the amount of care involved. Now, you were experiencing some perimenopausal symptoms and stuff like that a while ago. What mainly was bothering you?
Well, I think it was menopausal symptoms, actually, and I can remember the day they hit me, February 28th. It was just dreadful. It's the worst thing I'd ever been through, and I've been through a lot of, as you know, health problems. And so, yeah, it basically was severe hot flashes. I wasn't sleeping anymore.
Okay.
And all day as well. I mean, it was just breaking into sweat, and consequently not being able to concentrate, and then consequently being very sad because the change was so extreme, and it didn't seem to be anything I could do. The women that I then spoke to were saying, "Oh yes, this has been going on for me for years," and I thought, I can't imagine going on for years with this.
Well, I was glad that we were able to put an end to that in a brief period of time. Mary, I want to thank you for your time and effort with helping me today.
It's very easy.
And I want to thank you very much for watching. I'm Dr. James R. Golding for Natural Healthcare Alternative. Have a wonderful day.